Those of you who are in this stream earlier will see there's already been fantastic representation of University of Nottingham, and that is about to continue. So that's fantastic, because Kirstie joined the University of Nottingham last September as a clinical assistant professor in equine medicine, having graduated from University of Glasgow in 1996 and completed both a residency and PhD at the Royal Dick, and becoming a diplomat of the European College of Equine Internal Medicine in 2009. I can only assume she sleeps very quickly. Kirstie has worked in both clinical practice and academia, both here in the UK, but also in the States and in New Zealand, and has a passion for teaching, for equine medicine, and also neurodiversity and well-being in the veterinary profession, and is here to chat to us today about student perceptions of using 2 mental health apps during the COVID-19 pandemic. Kirstie, thank you very much.
Thanks very much, James. So yes, this study looks at, it's a pilot study looking at the use of 2 mental health apps at Nottingham University during COVID-19. So as James said, I started at the university last September, so we were already into the COVID outbreak at that time. And we know that vet students in general are a bit of a vulnerable cohort. They have a high prevalence of mental health issues that's been well documented, and previous reasons as barriers that they've cited as barriers to accessing support have been lack of time, poor availability of services, and stigma. On top of this, we had COVID, and so we were quite worried about the students with a lot of remote teaching. They were not seeing a lot of people. They were stuck in halls of residence, staring at screens for lots of hours a day. And we had some, and data had been shared at this point, that young people were actually being most affected with depression and anxiety and stress during COVID. And this is despite this young age group actually being least affected by COVID. And this study had also shown that a positive mood had a significant impact on well-being. So we thought that internet-based interventions such as smartphone apps might be useful, one to help get around some of those barriers to accessing support that vet students had previously mentioned, but also to target students and give them some support whilst they were remote during their teaching at the university. So we very quickly put this project together, and the study was approved by the University of Nottingham, and we put a shout out to students across all years in October last year. And we did that by email and over Teams, sending out a group shout basically to all years. And anybody who replied that they were interested in hearing more about the study, we met on Teams and gave a briefing about the project, what we hoped to achieve, and showed them how the apps would work and what they would need to do. If they were still interested, they went on to sign informed consent. And we also made it very clear that of all the support networks that were available to them, both within the vet school, the wider university, and also the surrounding area, and other things like Vet Life and other support groups that are out there. So the apps that we chose were a little bit, we were a bit limited because we didn't want any cost to be involved. So they needed to be free for the students to download, and they also had to allow data sharing. So that really did cut down our choice quite a lot. But we picked 2. One, a meditation-based app called Smiling Mind. This is an Australian meditation app. And actually, this is really quite a big app in Australia, and they now use this app across all primary schools in Australia, and are doing a really big project looking at the use of mindfulness in primary school age children. And then the other app that we used was a CBT-based app, which was actually devised for the Canadian Fire Service. and that allowed mood tracking and also access to some CBT tools, and that was called Mindshift. So students were randomly allocated to one of these apps, and they were asked to use it for 8 weeks and share their data with us. And then they would swap over to the other app for another 8 weeks. So this is what the Smiling Mind app looks like. So the students were asked to complete the Introduction to Mindfulness program, which contains 6 sessions, and that only takes 15 minutes to complete the whole module. And they could do that either in one sitting if they wanted, or they could do it one a day, or however they wanted, basically. But we asked them to complete that introductory module and then access the app as much or as little as they wanted to, but to share their data usage with us. And that's, you can see here on this is how it opens up. It shows your number of sessions and also your time spent meditating, and this accumulates over time. So if they shared this screen, we knew how many sessions and how many minutes they had spent in total on the app. This is what the Mindshift, the CBT-based mood tracking tool, looked like. So it opened with a screen where it asked you how you were feeling, and then you could rate your level of whatever emotions you wanted to track. So if you said you wanted to track anxiety, you could rate that. And then you could give specifics about the detail of that moment. So if you were stressed about exams or something, you could write that in the little journal bit. And then it also allowed you to track particular symptoms. So you could state which symptoms of anxiety that you had. And we asked students to log their mood on a daily basis, and also as often as they wanted. So this tool actually allowed you to access it as many times as you wanted. And so you could do what's termed Ecologically Momentary Assessment, or EMA, which is basically real-time tracking. So you could, if you were feeling particularly anxious, maybe in a practical or something, you could access it there and then, and you could write your real-time assessment down. And that's meant to be more accurate because it avoids recall bias if you do it at the end of the day. Within this app, there's also these CBT-based tools. So if you want to look up ways to help with anxiety, you can access those. And there was also this quick relief sort of part of it, which were mindfulness tools and things like that. Important though that this Get Help was not accessible to them because that just gave you a number in Canada to access support. So we did make them aware of that. And then what they shared was this check-in screen. So we could see how many check-ins they've done per week. And they were asked to share this weekly. So this one, and we asked them to do this at the start of the study at week 8, which was the end of the first app usage, and then week 16, which was the end of the second app usage. And these, the respondents provided an anonymous ID, so we could look at people over time with it being anonymous. We also collected some feedback about their thoughts about the apps at the end of each app use. And we also sent out a follow-up survey at 12 months to see if any of them were still using these apps. So this WebWebs, as Fergus described earlier, it's Likert scale scoring of how you're feeling with, and it can score anywhere from 14 being extremely low to 70 being extremely high well-being. So 34 students registered an interest in the study, 28 started the study, 20 completed the study, and we had representation from all years apart from final year, and all identified as female. Only 17 of the 20 returned all of the WebWeb scores. So when we looked at app use, so this is the Smiling Mind meditation app on the Y scale, and this is the mood tracking Mind Shift app on the bottom scale. And you can see that there's very poor correlation here. It's 0.2. So really, there's only these 4 students that really actively engaged with both apps. Most students were very much preferred one app over the other. And as you can see, that's pretty even. Some really liked one app, but didn't engage with the other, and vice versa. And actually, so this is the number of meditation sessions. So it was a median of 16. Some had no engagement at all, others really quite high. And you can see some people got up to over, well, nearly 1,000 minutes over 8 weeks spent meditating. So really, quite a lot. And again, some people checked in really frequently with the mood tracking app, whereas others didn't engage with it at all. So a lot of personal preference, it seemed. These are the WemWeb scores that we looked at. So on this side, we've got our meditation-based app, and on this side, we've got our mood tracking app. And this is looking at when they started using the app and when they finished using the app. And you'll see just from looking at this that there's no difference between the start and the end of them using the apps in their well-being scores. But what I think is really interesting here is if we look at the red line here, I'm hoping you can make out these coloured lines. So the red line is 40, which is if you're below 40, you have probable depression and poor well-being. And you can see that we've got some students in that category. The orange line is possible poor well-being and depression, and we've actually got half of our students below that line. And then this yellow line is if you're above this yellow line, you've got high well-being, and we've only got 1 student in there. It's important to note that these aren't the same students that have low well-being all the way through. Students went all over the place, up, down, stayed the same. So there was it's not the same students being really down all the time. What students liked about the app were, some people liked that the meditations were calming. People said it helped with sleep. The most common thing about the mood tracking was that it was quick to use. Some people liked the fact that they could write their thoughts down and it made them more aware of their thoughts. And you can see there is pretty evenly split. 8 preferred the meditation app, 6 preferred the mood app. 1 liked both and 1 disliked both. So you really can't please everybody all the time. Some people found it hard to engage with meditation. I think that's a common thing that's said about meditation. Some people found it time consuming and they didn't want to take that time out of the day. Some people didn't like how quick the mood tracking app was to use. And some people actually, it made them feel more anxious because they were having to focus on difficult feelings. The most common reasons cited for dropping out of the study were that they forgot to send their data, forgot to use the apps. They felt overwhelmed because, again, they were focusing on these feelings that were difficult. Some people felt other things they were doing were more beneficial for their well-being and wanted to concentrate on those. And some people just didn't like the apps. So 10 people thought that the apps had improved their well-being. 3 had no effect on well-being. 3 thought it did not improve well-being, but only 1 said it had a negative impact on their well-being. And 8 commented that there was better self-awareness, which I think is really quite good. And 3 said mindfulness improved, and 2 improved sleep. Sleep was quite a common thing that people commented on in the free text answers. So 12 months on, 16 people completed a survey, and only 2 out of 17 were still using the meditation app. None were using the mood tracking app. 5 were using other apps, 3 of which were using Headspace. Interestingly, 5 were using Headspace before the start of the study, and 2 stopped using Headspace and switched to Smiling Mind, the meditation app, because they thought it was as good, but it was free. And just a little shout out for the Mind Matters Kite app. If you are interested in trying an app, then I would encourage you to try that app. It's very nice. And that is also free. So to conclude, we're slightly limited what we can say about this study because we had a small sample size. I think the effect of COVID-19 is so big that I'm not sure any app whatsoever would have really made a difference. It did generate a huge amount of data, which was quite difficult to track, and different operating systems didn't always work the same, and it made it very difficult for some people to share. I think what was very clear was that there was no one size fits all to the app, and if you're interested in using apps to support your well-being, if you don't like one, try another, because there really isn't one that suits everybody. And I think further focus group would be beneficial in trying to tease out what people felt more about these apps. Thank you very much. I'm sorry if I went a little bit over there.
Only by a moment or two, Kirstie, and we'll forgive that because it was excellent stuff. So thank you ever so much indeed.